Some would argue that prisons were made for telemedicine. They're often located in rural areas where the physician population is limited to primary care providers. Specialty care is rarely close by, requiring the prison facility to transport the inmate and maintain security for an in-person visit. Here's a scenario in which the inmate not only doesn't leave the prison for medical care, but he also doesn't leave his cell.
All right, good morning, Mr. Michaels. How are you feeling?
Well, pretty much the same.
All right, how did you do last night?
I didn't get much shut-eye. Pretty much fall asleep and wake up coughing all night.
All right, so you've been fighting this for a couple days now. I think this is probably more than just a simple cold. I think we should probably get a doctor involved.
You get to go now or
well, actually,
later?
We're not going to go anywhere. We're going to stay right here. We're going to use this mobile telemedicine station to contact the provider. Dr. Evans is in Gardenia, off-site. We're going to contact her. Let me get this thing ready.
Hello, this is Dr. Evans. Who's calling, please?
Hi, Dr. Evans. This is Jerry Barnes. I'm the head medic here at Bartlett Prison. I have one of our inmates here with me. This is Jeffrey Michaels. He's been suffering the last couple days from a cold.
We can provide services to inmates without having them leave the facility. Safety-wise, it helps both the correctional, it helps the site that they would be going into, the physician site. So most of the time, we can keep them from ever having to leave. Traditionally, we've seen about 56% of inmates that are seen through telemedicine never have to leave the facility.
Telemedicine also helps resolve the issue of who pays for an inmate's health care while eliminating the risk to other patients and providers in a hospital emergency department.
So that's a cost savings for the state, but it's also a safety issue because when an inmate leaves, 2 guards have to transport that patient, and then 2 more guards have to replace them. So it's a costly event to get an inmate transported for something that might be a 15 or 20 minute visit that didn't need to be transported in the first place.
So we get a lot of calls that we call arrestitis. We know they're there simply to get out of jail. The truth is, in our system, if you say the right words and you're arrested, they're brought to the ER. The jail and that correctional system does not want to pay the emergency room bill, so they de-arrest them. They do. And leave. And they're now my patient. And I have to sort it out. And it's very difficult because I'm discharging these people to home. They're patients. And sometimes they'll tell us when you're ready to discharge the patient so that we can come back and pick them up. That's a really odd situation, but that's my world.
Well, Michaels, I hope you feel better. It'll probably take about 24 hours. Thanks for your help, Jerry. We'll end our visit now and let you take it from here.
All right, thank you.
With tightening agency budgets and concerns about bringing prisoners out into the general population, telemedicine makes sense. Inmates can receive timely assessments, treatments, and follow-ups that may prevent an illness from becoming more serious. For GlobalMed, I'm Roger Downey.